When Diana Greenspan discovered she had low bone density after doing an osteoporosis screening at a local health fair, she was surprised.
It came as a shock to me, and I was actually annoyed. I consider myself a healthy person, eating all these right foods and going to the gym and, watching everything. And I was really kind of annoyed, and it's so internal, you don't really know you have it.
Osteoporosis is a condition that relates to the loss of bone density. And the risk of osteoporosis is that it can result in bone fracture.
Diana fits the typical profile of a patient at risk. She's Caucasian, has a small build, and as she found out, a family history.
I have an older sister, and I discussed it with her, and we came to the conclusion that my grandmother, who had several broken arms in her 60s and a broken hip, that in fact she had osteoporosis. So it does run in families, and it definitely was there in the history.
Smoking and taking certain medications can also make you more likely to develop osteoporosis.
The people who are at greatest risk of getting osteoporosis are women when they become postmenopausal. At the time of menopause or the change of life, there is a accelerated loss of bone density, and it's after the menopause that women become more at risk of sustaining bone fractures. The screening for osteoporosis is with the use of a DEXA scan, and that's a type of x-ray test. It's very easy, it doesn't hurt, it takes about 10 minutes, and 2 areas are scanned, typically the hip or both hips and the lumbar spine, which is the low part of the back. And those are the areas that can most effectively identify if there is low bone mass.
After Diana received her diagnosis, she started taking steps to try and prevent further bone loss. She takes a medication to help her build up bone, plus calcium and vitamin D supplements. She also does weight-bearing exercise.
I went to the MUSC Sports Center for some physical therapy, where they specialize in teaching you how to preserve your spine when you do sit-ups, so that you're not compromising your bones, and how to do balance exercises, and just how not to put your bones at risk.
So there are a lot of different options for the treatment of osteoporosis. And these options also are all very effective to reduce fracture, and that's the whole goal, is to reduce a person's risk of fracture.
I didn't have to get this far down. And if I had been tested earlier and put on the right medication, it probably could have been stopped at some point. And also, if you're just not taking your calcium, not taking vitamin D, it's important to have the test and to know that you need to do that. Just before you have a fall and find out that way. A broken arm, you say, oh, guess what? You had osteoporosis.
Diana is hopeful she's doing everything she can to prevent a fracture and keep her bones and her future health intact.
When you're over 60, the prognosis for healing from a hip fracture is not good. You're really immobile, and you're lying there, and all kinds of other things set in, pneumonia and everything. So I really want to avoid that, and if it just means taking a little pill, well, I'd rather do that.
For more information or to make an appointment, call MUSC Health at 843-792-1414.